During menstruation, pain in the lower abdomen or legs for 1 or 2 days many feel. For many, however, these pain or period cramps several days continued. Because of its intensity, the rhythm of daily work is also lost. Gynecologists report that the pain that occurs during this period is called dysmenorrhea. Nausea, headache, upset stomach, irritable mood, these are various symptoms to appear. Can as a result in those few days concentration on work becomes difficult. Pain due to this pain from the day of menstruation may begin to occur. Some people, as seen in the case, very short time 1 or 2 days on average for mild pain. With increasing age, this pain comes less. Again, in many cases, even after delivery, this pain subsides. According to doctors, this is primary dysmenorrhea. Many more during menstruation overcome with a kind of pain. This is called secondary dysmenorrhea. These symptoms of pain are also the same, but the intensity is very high. In this case, a few days before menstruation and after that, there was a lot of pain. These menstrual pains persists even after delivery. Way of release. Because of pain during menstruation, many people first take medicine. Doctors recommended non-steroidal anti-inflammatory drugs NSAIDs for pain relief. Much can be reduced. Within 1 or 2 days, this pain is relieved by this medicine. But whose liver, stomach problems, asthma, or they are allergic to aspirin, it is better not to take such medicine. Exercise comfort. Fitness experts inform that in all these cases, the weight control is most important. Too much or too little weight for two reasons. Menstrual cramps may occur. If from adolescence onwards bodybuilding habits do, however, body does not accumulate fat easily. About this, the awareness of parents is also important. There are many such exercises at home. Keep your weight under control. Bending for a while before exercise, it is convenient to warm up. Firstly, side, front and back bending has to be done. Something with these clockwise and anti-clockwise bending can also be done. Followed by cardio such as Zumba, exercise like aerobics, jogging can be done. These type of exercise are very good. With some wall push-ups and squatting can continue. Next is the most important abdominal exercises. Leg raise, double leg rowing, plank exercise can be done at this time. Experts say that abdominal exercises can reduce menstrual pain more effectively. There are many exercises that leg pain during menstruation also helps to reduce. Side thigh, inner thigh exercise relieves leg pain. Experts also say that whatever the age, maintaining fitness is very urgent so that the upper and lower body parts ratio is correct. It needs to be looked at. The stress of studying in school and college or in the busyness of work life, many are not able to do exercise in their daily life. Due to that, various diseases enter in the body. If 30 to 40 minutes of exercise can be kept regularly, the body will be healthy and menstrual pain will also be reduced. Goodbye misconceptions. Many people think that during menstruation it is not right to exercise on that time. Because of this thinking, the problem may escalate. Experts say that this idea is very wrong. If it is very painful, still light exercises can be done for 1 or 2 days. In all these cases, it is better to follow the advice of experts. Essential practice. In addition to exercise, some rules need to be followed in living. Doctors say that a little bit of hot baking on the lower abdomen comfort can be found. Good sleep is essential before and during menstruation. Keep mind light under pressure. Many people have a heavy head because of stress. It is important to keep the mind calm. If so, the mind will be relieved from the thought of pain. Thank you.